Okay, so there are a couple more things that I would like to add about the American Red Cross volunteer. And I think it's important to understand that, while I'm working, pretty much in healthcare roles, that's not always the case. There could be volunteer nurses who work for the American Red Cross, driving a forklift in a warehouse somewhere, or building a tent, or delivering water, or serving meals. So it's important to understand that the Red Cross supports their nurse volunteers to do whatever it is that they want to do within the organization. But what's amazing and really important to understand is that, I am a nurse. I am a registered nurse, so the American Red Cross has verified my license. They keep a copy, an updated copy of my CPR. They know where I'm at, understand how to contact me, and they've trained me. Like I've received all the basic training that I need to, and that gives the American Red Cross the opportunity to mobilize registered nurse volunteers in a disaster or if the time ever came, which is pretty amazing because you think about it. There are times where I am available and can do whatever they needed me to do, but other times, during a semester or the beginning of a job or during a move, my availability is limited, and I don't feel like I'm letting them down. There's always something that I can do within the organization. So I think it's important to understand that. And then one more thing is just to keep in mind all the training courses that are offered through the American Red Cross. So in addition to certified nurses aid and CPR, there are several training classes available. Also, lots of learning management, webinars. There are courses that are available online only, classes that are available in person. So for a nurse volunteer, let's say you're a staff nurse and you're trying to figure out, do I go into the educator role? Do I go into the management role? You could volunteer for the American Red Cross and teach a CPR class or teach a nurse training class. And that's an amazing opportunity to get that exposure, that experience, and that training because the American Red Cross doesn't just send you in to do anything. You have managers and supervisors, and there's nurse leaders. And that's probably the last point that I'll make just in general about being a Red Cross nurse volunteer is that there is that leadership. And it's been very inspirational and motivational to me. Like, for example, when I've been working on this project, lots of the resources that I look up or book chapters were actually written by nurses who have worked within the American Red Cross and now work at, in national committees and at the national level, serving several different organizations, not just related to public health and emergency response. Okay, so I'm going to go ahead and start talking about the American Red Cross as it relates to, transitioning from disaster health services, which is what I did before, now over to services to the armed forces. And services to the armed forces, like I said before, is what it sounds like it is. You're working with military members and their families. So it's a very specific patient population. And I say patient, you can say client, lots of times family, because my background, my dad was military, my husband's retired military, so I've literally been a military dependent my whole life. So to me, it's family, but still my patient population. Okay, so working within services to the armed forces, I was able to. You've got services to the armed forces, and then emergency communication is a branch off of that. And within emergency communication comes the on-call medical liaison role, which is what I've been doing this semester. So that's been my primary role this semester. So services to armed forces, emergency communications, and then the on-call medical liaison role. And these are all part of the casework cycle. And these are all services that are available to the military members and their commanders and their families 24 hours a day, 7 days a week. So you can only imagine, how many people and how much of an effort and coordination it takes to actually be able to offer these services, around the clock. And not just locally or nationally. This is really a global effort. So I just want to be sure to mention that.